Thigh and groin injuries. These are injuries that can be very misleading, but are something that happens quite a bit, especially in hockey and soccer, but they can happen in any sport. If you look at thigh injuries, you can see this big white mass on this leg is what we call a myositis. It's bleeding into the muscle and it forms calcium. And if you don't take care of it properly, it can be really painful and can end up ruining your career. The hamstring strain is something that happens quite a bit, and it's something that you have to look at the muscles below and above. We had a kid on the football team who had bilateral hamstring issues, could not get rid of them. We finally looked at his lower back. He had no flexibility there. Once we fixed his lower back, his hamstrings were healed. Quadriceps strain, you can have a quadriceps strain anytime. These are really difficult to get over. And you can see people get dead legs where they get kneed in the leg. And this can lead to a myositis if it isn't taken care of properly. You can see in the anatomy of the groin, there's quite a few muscles there. The lower abdominal muscles attach onto your symphysis pubis, which is right in the middle. You can see that a lot of the quadricep muscles, your iliopsoas muscles, your groin muscles all attach right there. If you're a male, you're really more susceptible to having a hernia in this area because your spermatic cord comes right through your abdominal wall, and that can lead to all kinds of problems, especially if there's weakness or a little tear. A lot of ice hockey players, especially professional ones, have injuries here because of the skating, and they become so tight and it tears on them. So these are areas that you have to really pay attention to. A lot of times kids will have groin injuries, and it isn't really the groin that's the problem, it's their SI joint. And we'll talk about that later when we get into the spine. If you look here, you can see the x-ray. This is the pubic bone, the symphysis pubis. You can see it's all rough and ragged. It should be smooth. And if you look at the other picture, you can see where it's the superficial ring where the spermatic cord comes through for the men. And it can be a real problem if you're having issues there. So how do you prevent it? Well, you can do rope stretches. We have joint mobility. We have the 10 station stretching. You can go off the table and you stretch your groin, your hamstring, and your butt. You can do different wall slides, and you can do different knee types of sliding. You can get a groin strain. You can have osteopubitis, which is one of the goalkeepers at BU who played on ice hockey. He was the #1 draft pick. He had osteopubitis, and it was a problem. We had to end up getting surgery for him. You can have SI joint dysfunction, which causes groin issues, quad or hamstring issues. You can get a myositis. You can get an IT band, which runs down the side of your thigh, and you can have weak glute muscles. So when you're looking at a groin strain, you have to look at all these different areas and not just assume that it's the groin. It could be caused by an SI joint problem or something else.